Welcome back, everyone. Dr. Darlene Weier is with us today, the Women's Health Center Director at Lima Memorial Health System. We're talking about new technology. I love when we get to talk about this new tech that you guys always have coming in. One of the issues we've talked about in the past, especially when you're doing mammograms, is women that come in with dense breast tissue, and that's an issue. Kind of explain the problems you have there.
Yes, when a patient comes in and she has dense breast tissue, basically what that means is that she has a white glandular tissue in her breast. And if she has a lot of that, or it's heterogeneously dense and scattered throughout the breast, it can be difficult to find teeny tiny little small white breast cancers, because all cancers are white on a mammogram. And if she has a lot of white glandular tissue, a small mass can be obscured or hidden. So it's always been difficult to zone in on those areas to see whether or not something is obscured or hidden by that dense tissue.
As you said in the past, the key is to get the best picture possible. Tell us about the new screening. You've got some new technology that makes that even a little easier and even a little more clear.
Yes, we are so excited to be the first in the region to have this new imaging modality available and to offer it to our patients in the community. Basically, it's an automated breast ultrasound examination. It creates a 3D image of the breast. It uses no radiation. We look at the entire breast tissue. And what it's able to do is to zone in on that dense tissue and basically see through it to see if there's a little small mass that is hidden behind that white glandular tissue. Because on the ultrasound examination, the mass will be gray or black in comparison to it being white on the mammogram.
Yeah, it's fascinating to watch this and see what it does and almost cut it into sections and getting so specific. For a patient that comes in that's going to get this kind of screening, kind of walk us through what they might expect.
Yes, the exam, there's no pain with the exam. She would lay on her back and there's a lotion solution that we would put over the breast. It's a soft paddle that would gently be placed upon the breast tissue. It would scan the entire breast. It creates a 3D image. It only takes about 10 minutes per breast. And then we wipe the lotion off and she's free to go home.
Sounds great. As you said, no radiation at all involved, so there's no side effects from that. Are there requirements for a patient to get this kind of imaging?
Yes. We would do it on patients who have heterogeneously dense breast tissue or dense breast tissue. And we would determine that by looking at her mammogram study to see what type of breast tissue she has and whether she would meet criteria or not.
So, Dr. Weier, if there's a patient out there and she hears this and sees this and thinks, that's something I would be interested in, what does she need to do? Or someone who just wants to set up their yearly mammogram?
All they need to do is to call the medical park at 419-998-4497, and we'll get her scheduled to come in and see us.
All right. Technology, it just keeps improving. It's hard to keep up. Thank you, Dr. Weier. We appreciate the explanation.
Thank you.
You bet. Nice chatting with you. We'll be back right after this.